Hello viewer, welcome to Health Talk. It's here that we learn a lot about our health and we inform you about our health. I'll quote Robert Urich. He said, a healthy outside starts with the inside. That's why at GBS, we always bring you the best guests, some of the best around the country, so they can empower you about your health, so that even the outside you can be great. We'll be in studio. I have an amazing guest. I'll let him introduce himself. Welcome.
Thank you so much. My name's Alex Bett, nurse oncologist, specialized, and I'm here today to share more on the issue of health. It's very key in life, and thank you so much for being here. I'm very glad.
Thank you, Bett. And it's a pleasure having you in the show.
Thank you.
Viewer, today we're going to talk about cancer of the prostate. And my guest, he's so much empowered on that. He's going to give us some enlightenment about cancer of the breast. What is cancer of the prostate? What is it? Because you just hear cancer of the prostate. What is this thing? So we're going to find out from my guest today. What is this cancer of the prostate? Is there a treatment? What are the signs and symptoms? Our social media handles are GBS TV Africa. Our SMS line, 21144. Drop your questions, your comments, even clarifications. We take them also. Welcome, Bett.
Thank you so much, Ben.
We are talking about prostate.
Yes.
I know some people are wondering, what is prostate? What is a prostate gland? Then where is it found? Because the guys are wondering, this word, is it from the moon up there? It has just dropped right now. What is a prostate gland?
Okay, thank you, Ben. And the viewers, I want to take you through the prostate gland first, so that we know this is a main
what you are
issue.
dealing with.
Yeah, we are dealing with. This is a main issue.
Okay.
Actually, from the other cancers, this one is a bit restricted to men, because men have this gland called prostate gland, which is very important, very key gland for men. Actually, it's part of the reproductive side that actually produces some fluids, especially during an intercourse, which will nourish the sperm and also will allow the transportation of the sperm, especially during the reproduction, as far as reproductive part is concerned. So it nourishes and facilitates actually transportation of the sperm.
Okay.
So it is one of the key, very important for men. So this is one of the very key gland in our body. Yes.
Wow.
Yeah.
Viewer, underline the word very important. He has said very important in men. So men, you need to sit down and you listen to this. Now, let's talk about, we're here to talk about cancer of the prostate. So that my viewer can understand, what is this cancer of the prostate?
Thank you, Ben. This is prostate gland is one of the glands which is not spared by the cancer as far as cancer is concerned. And I think to the viewers, cancer is a situation whereby the blood, the cells grow out of control. Okay. And prostate is not spared. Okay. And when we come now to the prostate cancer, this is a cancer whereby there is abnormal cell multiplication in the prostate. And remember, prostate is located in the, below the bladder. And we know the function of the bladder is temporary storage of the urine. And in front of the prostate, there is also rectum. And we know the function of the rectum now to allow us for digestion or to get rid of the waste products in the part of the GIT or the abdomen. Then also, below also the prostate gland, there is the urethra, which does away with the, that is now the passage of the urine from the bladder outside now to during the excretion of the passage of the urine. So when there is abnormal multiplication, actually the gland size will increase in the size. Okay. And when there is an increase now...
So in cancer of the prostate, it's just that gland
increasing in the size.
It increases in size?
Yes. So when it increases in the size, the main signs and symptoms are always the urinary symptoms. And the symptoms are as follows now, whereby we have urine hesitancy. Yeah, somebody goes to the washroom or tries to initiate the urine. It takes some time. There is also actively urination during the night. That is one of the sign and symptom of the prostate cancer. There is also blood in the urine. We call it hematuria, because actually because of that pressure to the urethra, you find a situation whereby there is some injury to the site, and that is why you're able to see the urine with the blood. Also, even the semen, because actually we have to, the urethra is a multi-purpose part of the body, because actually we used to remove it's a passage of semen at the same time for urine. So so semen will having also the blood because of the same injury that will pass through the urethra. Also, we will have also dripping of the urine immediately after somebody has finished peeing. So you're able to see some dripping. There is you're in a position to control the same. Also, we will have after having now the dripping, there is urine stream, which is very key. When somebody is still at a tender or a young age, the stream is very sharp, very high. But now when we have this issue of the prostate, the urine stream will come low.
Okay.
Yeah. But the late signs now is when these cancers move to the other side of the body, that is now outside the prostate gland itself. It goes to the bones. Bone pain will be there. And then we're having the issue of painful, especially when going for a long haul because of the pressure on the same side. And also it can travel to the lungs, to the other side of the body, and that's we're able to feel the symptoms on exactly the area that the same cancer have moved to.
Oh, okay.
Yes.
Wow, that's so elaborative.
Yes.
Bet. What I heard you talk about the stream. I remember when you were growing up, we used to compete who will project the urine farthest.
Yes.
But as we age, you find it is just dripping just around here. You can't have that. So that's what you're talking about, the streaming.
Yes, the stream.
Now, also there's something that I noticed with our society. Our old people, our grandpas, our fathers, or maybe our elder brothers, after coming for a shot, you talked about the dripping. You find the front part, the fly, is wet. So it should be also a concern to us that my father or my grandpa has wet trouser after going for a short call. I should now begin instead of laughing, I should now begin to think about some other things.
Yes, very important question, because all men, when we reach 50 years and above, there is a slight increase in our prostate for all men. But now that is, we should now take very seriously, because we need to know this increase, is it because of, is it cancerous or non-cancerous? Because actually we have two. We have the one, we call it benign prostate hyperplasia, whereby there's an increase because of the hormonal levels, that is testosterone goes down. You expect that to happen. And that is why our grandfathers at that time, you said, actually may experience that once they finish going for the short call, you'll be able to see that in their trousers, but because of the enlargement of the prostate. So when we have this prostate cancer, same apply for such occurrence that you're able to see, and you should not, you have to advise this patient actually to go for the check of the same, because he may be likely to be suffering from the same condition.
Okay.
Yes.
Wow. Now, that's so informative, Bet.
Yes.
Let's talk about the cause and the risk factors.
Thank you, Ben.
If you reach a level whereby now you say, can you say this cancer, he has cancer of the prostate, the cause is this, or what are the risk factors that can predispose somebody or lead somebody to developing cancer of the prostate?
Thank you, Ben. We don't have specific cause for cancer, but we have the risk factor. These are the things that are likely to have the same, or to take you to have the same cancer. So we have age as one of the first risk factor, because I've said men 50 and above, actually there is an increase in the size. And this is the time that we need to check. There's many, I'll be able to tell you more about the screening methods, but for now, age is key here. You'll not find men below 45 having the prostate. So age is key here. So 45 and above is is the age that we have to start watching on the prostate cancer. We have strong family history, especially first degree. If there is in your family there is person who passed away with the same, that's why you are very key in taking care of, especially with checking on their history. So strong family history, especially first degree, which carries the most people who are susceptible to this prostate cancer.
Prostate cancer.
Yes. Also, ethnicity, the Black American or the African are the most people who are susceptible to this breast cancer, the prostate cancer. Okay. Then also we have men, gender is, that's why we don't have female on this.
Because they don't have that gland.
Exactly. So male, gender, obesity plays a key role here.
Oh, okay.
Yes. We also have exercises. Somebody who's not actively exercising would at some point will have to check on this, because actually that's how the body will have some radical changes which may predispose you to this prostate cancer. Okay. Also, we consider diet, especially the fatty, and we advise the people to reduce the fatty kind of diet, which likely would take you to have this prostate cancer. Okay. Then also we have smoking, as part of this. It plays a key role in, it cuts across all the other cancers. So smoking is another.
Okay.
Yes.
Tobacco use.
Tobacco, and then there is genetic constitution, that is if somebody inherit some of the genes which likely would to predispose some from the family still.
So it runs, you find there are some which run in the family line.
Yes, family line.
So that you find, maybe you talked about the first degree, if father or grandpa had, or brother had cancer of the prostate, chances are very high.
Yes.
Then you talked about age.
Age.
Men above 50 years,
yeah.
They should be taking it serious.
Yes.
And going for the examination. Wow, thank you so much for that. I also discovered that tobacco use is in most cancers.
Yes.
And most guys, they normally use tobacco outside there. Now, before we go to the preventive measures there, what do you have to say about this tobacco? Because I've discovered in most cancers, rarely do you find tobacco not being mentioned. You find the risk factors, it has a number.
Yes, a good question. For those who are using tobacco, it is one of the things that we call it's carcinogenic. It will drive your cells from the normal cell which divide and in the normal manner which the body have been organized. So this is one of the carcinogens that actually will change your cell setup. So we'll advise our team outside, prevention is better than cure. Wow. You rather cut it short using of tobacco or do away with, so that actually you are able to have a good life and avoid predisposing yourself or taking yourself to this prostate cancer. So I will advise the team outside, please, and my viewers, that please, we need to cut short of the use of tobacco so that we are able to control this prostate cancer. Okay. Thank you.
Wow. So tobacco, we should begin to cut on using them. I know that will be a topic for another day, because when you talk about the passive, you find somebody just smoking in public.
Yes.
They're also endangering other men who are also not even smoking. But that's a topic for another day. Now, about the risk factors still, what can you advise somebody who has a history, a positive history of a first-degree relative with the cancer of the prostate?
Thank you. I will advise especially for those who are having the first degree in the family, we need to be watchful and take some precautions. Once reaching as early as 45 years, you need to work on this, checking mostly on how your prostate behaves, because that is the time that we want to keep on track, checking on this, to ensure that we take action early for the better outcome.
Okay.
Because we advise the first degree, this team, to have some tests which will be recommended by an oncologist, that is medical oncologist, because we have them on board, so that keep on checking on this prostate actually, starting from 45 going forward. This will help a lot, so that we're able to work on it as soon as it sets in, so that the outcome for the same will be awesome.
I'm looking at a scenario whereby in our African culture, African setup, there's that taboo about sex. We don't talk. And this organ, as you said, is almost like a sexual part.
Yes.
in us men. Culture whereby I cannot, my father, my grandfather cannot talk. Maybe I can imagine maybe they maybe just with the granddaughters or daughter. So they cannot mention such things. According to them, it's a taboo. So can we demystify this thing so that our men outside there, 50 years and above, maybe give it positive family history of prostate cancer? They can come out so that we can detect this cancer at a very early stage.
Thank you. It's very important. That question actually has been asked by many people, because actually these are a reproductive organ which most men shy to talk about it. And it is good to have a conversation on this. We have quite a number of good hospitals in the country that the men 45 and above, actually there are quite a number of programs, free prostate cancer screening, which are run mostly by men.
Okay.
And they are able to go visit there, do some blood works to check, especially we have one of the blood works called the PSA, which is very key. This is one of the protein in the body which is produced by the prostate gland. That is one of very key blood work that we need to have it. There is also another one called, there's an examination which can be done called a DRE, that is digital rectal exam, to keep a check on the prostate, whereby the doctor will do an examination as a qualified medical oncologist. Doctor will be able to do and differentiate between the normal and the abnormal prostate, and they're able to give the report immediately to our elderly, especially with the brackets that we need to check on this. And then there is other tests that an ultrasound can be done, and then a biopsy also can be done. A small part of the prostate can be taken out for histology, check, and then a report can be given to our client, so that he's able to know the status of the prostate. Yeah.
Wow. This topic is very sensitive, especially when it comes to men. It's a sensitive topic, especially when you talk about this sexual reproductive in our culture. You know how sensitive that topic could be.
Yes.
It's like a hot potato. Handling it is hard. So, but I thank you so much, because you have said there are facilities. So they should not worry if you see your grandpa, your father, and you don't want maybe to tell him openly. You can just take him to these facilities, and they'll be done examination, and the correct form of diagnosis can be made.
Yes.
Wow. Viewer, we are learning a lot today. I believe you're also learning. I'm learning indeed. I'm knowing about prostate cancer. I'm having that picture of my father at home, because these are people we have in our society. Our fathers, our elder brothers, our grandpas. Cancer of the prostate, a very sensitive topic in our society. How can you do? Because he has talked about so many clinical features of even going to the lung. So before we reach that level of somebody coming with cancer has gone to the lungs, you're going to take a short break, and when you come back, you're going to find out the diagnosis. How do we diagnose this cancer of the prostate? The treatment, Do you have treatment modality in this country? Or somebody has to go outside the country and get the treatment? We are taking a short break, and please don't touch that dial. And remember to hit our social media handles, GBS TV Africa, our SMS line 21144.
Everywhere, GBS.
Welcome back, viewer. We are talking about cancer of the prostate. With me in studio, I have an amazing guest, Bet. He's taking us step by step on cancer of prostate. What are the signs that you need to watch to our old man there at home? Stop laughing at them when you see that maybe they have a wet fly. You think maybe they are careless or they are reckless. It could be cancer of the prostate coming up. He's developing cancer of the prostate and you are laughing. So let's find out, what can we do so that we can prevent this thing from becoming such a big monster in the room? Remember to hit our social media handles, GBS TV Africa, SMS line 21144. Now, welcome back, Bet.
Thank you.
Now, we are talking about the clinical features. Now, this, the presentation, you talked about the streaming of urine, hesitancy. My viewers are there. Maybe they have noticed this thing in their old man or their old guy at home. How do you come to a place where now you diagnose and you say, there is now cancer of the prostate? Can you take my viewer or take us through that process till you come to a diagnosis?
Thank you so much, Ben. To our viewers, it's very key to have a look on the screening methods that we are available in the country, and that will help us to reach our diagnosis, that is for the prostate cancer. Here we have, upon arriving to the facility, that actually over these services, of which many facilities in Kenya nowadays have incorporated the same program of, especially within that age bracket of 55 and above for all men, or 50 and above. So upon coming to the facility, the very key thing that you will be welcome into the facility and have a session with a very specialized oncology doctor to take you through, whereby you are able to have quite a several number of tests that will be run onto you. One, we will obtain the consent first to you, because this is a very crucial topic, because there are some other methods that we use that really need a consent between, especially these old men, the old people. Actually, at some point, they're a bit tricky in terms of convincing them about this test that we are going to take through, because we have the DRE, which is a digital rectal exam. After having your history from home, that we have having these symptoms of dribbling, the urine stream going down, nocturia that is having frequency over the night. So we're able now to have one of the tests to feel now the prostate through a digital rectal exam. Actually, to my viewers, I think you remember when I was introducing, I talk about it's the nearby structures, rectum being one of them. So that is a way that we will have to feel this prostate. And we will have to have a gloves, and the doctor will take you to the bed, feel the prostate, and give you immediately how the results. And the results that you're likely to have is, once the doctor feels a normal prostate feels very fine, as in very smooth when the doctor feels, but an abnormal prostate, that is now the one with the cancer, is a bit rough. And that is exactly the result that you're likely to get after an examination. The doctor will not stop there. We will proceed again and to do another blood exam, that is blood works now, to take your blood and take to the lab. There is something that we are looking here, Ben, and to our viewers. We are looking for one of the protein in the blood, which is called prostate-specific antigen. The normal levels, we check using something called, the calibration for the same is a nanogram, that is in terms of their levels. 0 to 4 is a normal levels, but now exceeding 4 nanogram per deciliter now, that is, we have to...
It has gone higher.
Higher, and that is
It's a
high
like an alert?
suspicion. Yes, it's giving an alert to the doctor. By then, we've not get exactly to know that this is, but we are suspecting, because actually the final one is called the biopsy. So we do the PSA, check on the levels, and they are different according to the age brackets. We have from 45 to 50, 55 to around 60, then 60 and above. So 69 and above. So now the doctor will be able to tell you the good limits, the limits that, okay, there's those within the limits that will not worry the doctor to proceed to doing another test. So by then you're able to know the levels, because I've said 0 to 4 is within the normal range. The doctor also will proceed and also do an ultrasound. You can be sent for an ultrasound, whereby they're able to check your prostate by now taking through an ultrasound, a scan to check on the size. Actually here the size matters a lot. Then now we go to do the last one called the biopsy, because we need to check on these cells. There is abnormal cells for the cancerous that is highly dividing, so we are able to present to the lab, and then the examination can be done to check if the cells are still within the normal structure, dividing the right way, or if now we in a position to have a biopsy and the results coming now to be cancerous, now then that is where we can proceed to advise the client on the management.
Wow.
Yes.
So it's what I'm learning is it's a journey.
It's a journey.
It's not just a one-day thing. Somebody stops to a facility, then before the end of the day comes out, oh, cancer. No. So it's a step by step.
It's a step by step.
Wow. Now, you have done the investigations. You have found out that you have taken a biopsy. You have said the confirmatory test is biopsy.
Biopsy, yeah.
So biopsy has been taken. Then you find out the cancerous cells. Is there treatment for this thing? Or that's the end? You just tell the client, by the way, sorry, this is what we have found out you have. Just go home and wait. Is there treatment?
Thank you, Ben. We have quite a number of modalities that I'm going to take you through. But prostate cancer mostly is a slow growing, and the doctor once confirmed, we have one of the modality called active surveillance, active monitoring of this prostate, whereby the doctor will, after checking the size of the prostate, and it may be there is no symptoms, because not all the prostate cancers have symptoms. Some have no symptoms at all, but still there is that enlargement, and it has confirmed that it is a prostate cancer. Okay. So here we give something called active surveillance, whereby we just monitor by doing the PSA daily to check on the levels, by also doing the scans to keep an eye on the
so
prostate
in this
cancer.
case, there's no intervention.
There is no intervention.
Any surgery.
Yes.
Or any form of treatment.
Yes.
To this client.
Exactly.
Okay.
So that is our first modality, whereby we observe, especially for those not having the symptoms. That is where we keep an eye until the doctor will, because we'll be having more frequent visits to the doctor, checking and being interpreted now then, whatever the test has been done to you. Then another one, actually the goal of this is actually we want to cure this, to do away the cancer itself. We have surgery as part of the modality. This is one of the modalities that we can do the radical prostatectomy. We remove the prostate with part of the surrounding structures. And this is another 100% cure as far as management for prostate cancer is concerned. And we consider a lot of things here in surgery, where we need to have something called staging, because for the stage 1 and 2 actually does well in terms of as far as surgery is concerned, because actually there is no spread or the movement of the cancerous tissues to the other parts of the body, so it's still within the prostate. So surgery does the best.
Okay.
Yes.
Now, if I may draw you, sorry for cutting you, if I may draw you back, in active surveillance, are there any risk, or maybe we talk about the side effect for treatment? Now, in active surveillance, is there a possibility of going wrong? Maybe the disease will come out with a bang, or what are some of the, how do I put it? Is it side effects or?
In active surveillance, then we mean the doctor is very specific in terms of taking care of you during the active surveillance. And there is no side effects here because actually there is no active or touching or interfering with the tumor. Here, the doctor will be monitoring based on some parameters, and that is, I've talked of the PSA levels, I've talked of the scan that can be done on the same to keep an eye on the tumor itself.
So this patient will be on active watching by his or her doctor?
Exactly.
Oh, okay.
We'll be having some good visits, which actually the doctor will prescribe, so that the patient will be having a conversation with the doctor one-on-one on the side of the active surveillance. On the side of the surgery, as part of the modality I've said, you consider many factors. That is why we need to check on the stage.
Okay.
It's very key, so that the surgeon will go in and do the surgery, and then now it will depend with the outcome. When the tumor is too big, the doctor may recommend some few doses of chemotherapy because it's one of the modalities. In the prostate, you can apply as many modalities.
Now, I'm trying to imagine, still back on that surgery. Then the organ you're talking about is reproductive.
Yes.
Then with an African culture setup. Does it have any effect on the sexual performance of? Because maybe somebody may be wondering or watching and is wondering, hapo mimi kazi yangu imeisha. I cannot perform my work to satisfy maybe my wife or to our viewer there.
Yeah, thank you. Thank you, Ben, for the same and our viewers. That is very key, and actually where we measure mostly when approaching surgery, we want to minimize the injury on the side of the part of the main activeness in terms of as far as sexual activities are concerned. The surgeon, and that's why I'm saying surgery, you consider a lot of factors. That is why surgeon will be very key to take care of the nerves, because actually that is a highly innervated organ, and the surgeon will try as much as possible. But the complications do occur during the surgery, whereby some of the nerves which supply the area is injured. And we'll have to take another step of now to have sexual support as far as sex is concerned, to take care of this gentleman, to ensure that he live to the expectation of the family.
So it can complicate, but they're very minimal.
They are very minimal, because actually the next part, nobody will operate any other person who is not expert on the same part. Actually, the surgeon will be considering to spare the nerves, but it will...
Which supply the manhood.
Exactly, yeah. But part of the complication for the surgery, that one for the sexual or erectile issues, and also we have the issue of infections, which may occur alongside, and also pain. Pain is one of the side effects for the surgery, but actually this patient is supported by the surgeon to ensure that the pain is well taken care of during post-surgery cares while the patient is at home. Another modality is we have chemotherapy also, which we are using drugs medically. We give through the vein in an hospital setup, because actually we are giving very hazardous kind of drugs which are very harmful to the environment, where there's other people who are not suffering from the same. So the patient will be given in the hospital setup. It will depend. Some may take a day actually for monitoring rehydration of the patient, ensuring that the patient is within the normal parameters so that can receive the same chemotherapy. There's also blood works which can be done for the same, so that to ensure that the patient is stable for the same drugs, because actually these drugs have a lot of side effects, like nausea and vomiting. There is also mucositis, whereby when you given some of these drugs may burn the part of your mouth. Taking food can be very challenging, but actually under the calculated doses by the doctor, and ensuring that you get well hydration, so that will allow also to get rid of these toxins in the body, so that you have fewer side effects as far as chemotherapy is concerned. And another one is also hormonal therapy. Actually, testosterone or the androgen here is key in as far as prostate cancer cells is concerned. So we also, surgeon can consider at some point if the hormone is giving this prostate cancer a lot of energy to the multiplication of the cells to go higher. We have two options as far as taking care of the hormone is concerned, whereby a surgery can be done also, do away with the testicles, because they are the one producing this androgen. So oophorectomy or removal of the testicles is key here, so that we control the hormone, which feeds now the tumor. And then also you can do medical castration. There is surgical, you do away with the testicles, and there is a medical one. There is an injection which is given underneath the skin, we call coserelin. It's one of the drugs which is used, and it will control the levels of testosterone in the body, so that now we are able to deprive now the tumor with the food, which this hormone plays a key role. Then the last one also, another list is we can utilize radiation. Yeah, we either have the external one, whereby there is a machine called a radiotherapy machine, which will under some, actually in this management we have quite a lot of key personnel here. We have the radio oncologist, and there is somebody who will work to ensure that they mark the exact point which is going to be radiated. And the patients, I think to the viewers, I think you've seen quite a number of patients who are going for radiation, having some marks which they have been put in their bodies, and with instruction telling them not to do away with the marks. Those are the marks that actually done to focus on the tumor, so that when they are giving the radiation, actually they are radiating specific, directly to the tumor, and sparing the nearby structures. Like the rectum, we need to spare, because the side effects for this radiotherapy also, as they are very well pronounced, that is, there is fatigue. There is also, when you radiate more on the rectum, there is an issue also, whereby the patient is having issues while going for long calls. So we need, the team here is working to ensure that they minimize a lot of side effects here by making those marks, and then the calculated doses by somebody called physicist, who will be able to calculate those doses together with the radio oncologist, to ensure that the patient receive specific doses for radiation towards the tumor, that we reduce more the side effects. And also still on the radiation, we have also the use of brachytherapy, one of the machine, which is very key.
Just hold on, Bet.
Yes.
I think we can take a break, a bit of break.
Yeah.
Then you continue picking it up from there. Radiotherapy. And still, I need us to talk about the surgery, the complications. I believe maybe our viewer outside there, maybe he has a question or two that maybe I can ask. The surgery, this complicated, because the hormonal treatment. You talked about castration.
Yes.
That word sounds so big. Viewer, I believe you are learning and you are getting a lot of information from my guest today about cancer of prostate. Go tell your grandpa, your dad, to sit down and watch, and he can pick one or two things, and perhaps it can save a life. Don't touch that dial.